World Sickle Cell Day. And to talk more on this, I've been joined by Dr. Vijay Kumar, who's Professor and Head Hematology Unit, Department of Pathology at WIMS and RML Hospital. Sir, first of all, thank you so much for joining in. Now to begin with, can you please explain in simple words for our viewers, what is a sickle cell disease?
Yeah, it's actually a very important question, particularly for our audience. I mean, all the viewers. That sickle cell disease is per se has got. I would like to explain. It is actually there are from mother and father. There are two alleles. I mean, this is sickle cell disease and sickle cell trait. These are two different things. One is when the one gene or one allele is defective. Is from in the simple words from the father. Baby carries one allele. From the mother side, it carries one. If one of them is abnormal, like normally, for normal hemoglobin, globin chain which is produced, particularly beta globin chain I am talking, that in this beta globin chain, one allele from father as well as from the mother, both should be normal. This is a very important point. If only one is abnormal, not a problem, that is called sickle cell trait. But if both the alleles are abnormal, that becomes a problem because that becomes a disease. And that is actually symptomatic. So I guess it is pretty clear that both the alleles, means both the genes coming from father as well as mother, must be abnormal for a child to get affected.
Okay, so it's a genetic blood disorder.
Yeah.
Okay, and it generally impacts the RBCs, red blood cells. Some people with sickle cell disease need blood transfusions. Can you explain something related to this?
Exactly. Yeah, very good question actually. What happens? The symptom and signs are variable, and it depends on various parameters. There are modifiers, but in simple words, in sickle cell, what happens? The shape of the RBC, which is normally biconcave, like concave from both sides, so that it can accommodate the hemoglobin. What happens? That when the sickle cell in the sickle cell disease, when the hemoglobin is sickle, that is hemoglobin S type, the entire RBC gets rigid. And this rigid RBC will not be able to pass through the capillary channels. And what happens? That it will get broken down, what we call it as lysis. So this lysis of RBCs gives rise to several problems like jaundice and different other problems. And it's not only the short-term problem. There is a long-term problem of the sickle cell disease also. So that's important to keep in mind. Like, for example, in early part, there can be increase in the spleen size, that is splenomegaly. But later on, there is a problem in terms of infarction. So what happens? The primary problem in the sickle cell disease, that the cell itself, that is RBC, is rigid and it is not able to pass through the RBC, and it is going to cause hypoxia and hypoperfusion in different organs.
Okay. Sir, also, since this is a genetic blood disorder, what is being done to cure it? Any advancements so far?
Yeah, actually, what happens, first of all, we have to diagnose it. I think treatment part is important, but equally important is the diagnosis part. Just few words about that. That we have to do, certain investigations like hemoglobin HPLC, high performance liquid chromatography, which helps to diagnose the sickle cell anemia or sickle cell disease, where we will get the S window. And secondly, hemoglobin F is also increased. Now coming to the, I think, treatment part as well as the newer recent advances. In the treatment perspective, first of all, we tend to counsel the patients to refrain from going into the area which has got propensity to give dehydration sort of thing. Like the person has to be good hydrated in a proper envelope, number one. Number two, there should not be any hypoxia or high altitude where it requires more oxygenation. Number three, another important point is good nutrition is equally important. But as far as the recent advances in the treatment is concerned, other than hydroxyurea, which used to be given to increase the hemoglobin F, nowadays even the gene therapy as well as the hematopoietic stem cell transplant are also available.
All right, sir. Thank you so much for joining in. Well, still to come on DD India News Hour.